Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished this month's board meeting and stepped outside to reflect on what has been discussed today in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
Hello everyone, it's Jim Austin here and I'm joined by Julie Holder, our chair, and this is our bite-sized podcast following the board meeting that we've had today, first Thursday in August. Julie, how was it today?
Thanks, Jim, and hello, everybody. So, as with many of our meetings, I think it struck me today more than ever that the four strategic themes on their own are really important, but when the magic happens is when they all work well together, and that's been common to a lot of our discussion today. So I just wanted to start by talking about our strategic theme of people. And what we heard today was an absolute fantastic example of the satisfaction and motivation that our High Peaks Navigation Hub team showed us in their presentation to us. And it was just great to hear. And I have to say that in the last 2 months since last we did this, that's really struck me in all of my visits. And what's been really important is to note that how great it is to be part of a really high functioning team that supports each other. That also came out at our recent Belonging Forum, where we talked about the importance of feeling comfortable to be ourselves and to be respected and heard wherever we are, and that really starts with our immediate teams. And you and I have talked about this quite a lot over the last few weeks, and we have said that we need to pay attention to this. You also picked up in your report our response to the UK Supreme Court ruling regarding the Equality Act 2010, and I think that's really important around the actual value of being respected for whoever we are. So we've heard today about the impact of continued uncertainty for our ICB colleagues, but also the pressure within the system, and particularly for us, our UTCs and community nurses, due to increased demand. And that's in the context of starting to plan for winter planning. And I know for many, it actually feels like winter already. We also had the annual Freedom to Speak Up report, and pleased to see that people feel comfortable to actually speak up, which is really important, but we spent time reflecting on the themes. Final thing I just wanted to say was a big thank you. This came out in our conversation today to our admin colleagues who have actually been responsible for the distribution of all nursing uniforms, changing uniforms. So a big thank you to them.
And it's not just nursing, it's a kind of national thing for all clinical staff,
Okay.
actually, so it's lots of different types. I think we also picked up a thank you on the progress that's been made on the Tier 3 weight management. And of course, we always review all the operational performance anyway, and pleased to report to the board about being on track financially. We're making the savings we need to make, still work to do, but it was, I think, a good discussion around that. I'm picking up a bit about partnership, really, and we had a really good story, and you've referred to it already, around the local navigation hub at High Peak, and we appreciate that we've got other hubs that we support as well around the place. It was really good to see local authority colleague and others talking about how they work with general practice, DCHS services, local authority services, the voluntary sector, and they gave some really good examples about how that hub can allow us to attend to residents, citizens, patients' needs in a way that, without coordination, is difficult to do. They talked about having the citizen at the centre of everything they do, and they talked about seeking forgiveness rather than permission. And the board were really encouraging that. Now, clearly, it was always done in a safe and effective way, but actually, I think we've probably got a greater appetite for trying things to do the right thing rather than being constrained in all those difficult things we've got to do. Just on partnership, I've been doing a lot of work going out visiting some of the Derbyshire County Council facilities, so Thomas Fields and Benley Fields most recently. Really encouraged to see the work that's going on there, and we have got a lot of work to do in that space. I'm going to hand back to you now, so I've got another session to talk in a second.
Okay, and for me, all of that is about working with communities, and what we heard today and what you're referring to there is just how important it is about working with neighbourhoods, and that's the central part of this, that will be the central part of the success of the 10-year plan, which is now published. Derbyshire has submitted an application for the National Neighbourhood Accelerator Programme, and key to that is the good progress that we're making already in the delivery of the Community Transformation Programme. But also the work that we've already done around creating Team Up and working with our partners in Derby and Derbyshire. I just wanted to also mention the insight visit I had to the Ilkeston catering team. It was a great visit, but what we heard there was how the use of the dining room by members of the community who take advantage of the facility, and we were able to talk there about the great community atmosphere that created, but the opportunity that there is for, say, for example, having wellbeing checks, etc., by actually offering that out to other parts of the community. I'll hand back to you.
So probably just to close it up, unless you've got some summary comments, I think it's quite an interesting dynamic around the board, and we discussed at the end of the day just how that works, and we challenge each other quite a lot. You're very welcome to come along to public board meetings in the future and see that in action, because it isn't just a kind of performance. It is definitely an interactive conversation that we have. I think the board were really thankful for the hard work that everybody's putting in at the moment. They appreciate the dissonance that there is just around the national messages around reorganisation that's going on in the NHS, really appreciating the hard work that everybody's doing, appreciating that does affect us. We talked around admin colleagues and the work that's going on there. We talked about some of the services and the hard work that they're doing there. So I think overall, the message from the board is thank you. We're on track. We're very well embedded within where the 10-year plan is heading. We're actively engaging with partners around the system about how we can take that forward. And while some people were taking a bit of a break over the summer, and we wish people well, it's important to get rest. Really, a big thank you from the board for all the work that people are doing.
Yeah, massive.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.